Hello, and welcome to this week's episode of the GLP-1 Hub podcast. I'm Anna Reisdorf, registered dietitian, GLP-1 user, and today I'm excited to welcome another one of my smarty colleagues. I just got so many of them, so many amazing colleagues, so little time, to talk about GLP-1 side effects and things that she's dealing with in her practice as people use these medications more and more. So you are going to want to listen to that. I also want to remind you, if you're loving the podcast, if you could leave a review, particularly on Apple Podcasts, would be great, or at least click the 5 stars. A written review is amazing. If you do leave a review and you send me a screenshot of your review, you can get a free recipe collection of your choice, breakfast, lunch, dinner, anyone that you are struggling with. I will send it over right away for free. If you want that, you can email me at hello@glp-1hub.com. Also, I'm always happy to hear from you if there's any topics you want me to cover. That would be amazing if you'd send me an email and I can try to find somebody to talk about that. We do have really cool topics coming up about microdosing, a couple of people sharing their personal stories, a few doctors talking about weight loss from a different point of view. There's someone coming on to talk about fashion in a few weeks because I don't know about you, but I got all this new clothes now that I lost weight on the GLP-1. I probably should stop shopping for it, though. It's kind of getting a little much. Anyway, and then finally, be sure to visit our GLP-1 Hub store where you will find our Beyond the Shot guide that will give you everything that you need to know if you are just starting on your GLP-1 journey. And also be sure to support our sponsors. We have a couple of new sponsors rolling out in the next few months, which I am excited about. So let's hear from one of those sponsors and get on with the show. So I'm super excited to announce a brand new partnership with NB Pure. You may have heard about them because they are the creators of MAG-O7, and this is a really popular product in the GLP-1 community. If you haven't heard of it yet, it's been helping a lot of our community quite a bit relieve constipation that can occur when taking GLP-1. So I first learned about MAG-O7 from a dietitian community that I am a part of, but I just kept seeing it pop up in the GLP-1 space as well, because it really does seem to be helping people. I did try it myself a couple of times because every once in a while, you don't get your fiber in quite as much and things kind of get backed up, and this clears it up overnight. So can really help you feel better if you're struggling with GLP-1 related constipation. So needless to say, it's worth checking out. For those of you who are wondering, MAG-O7 is an ozonated magnesium oxide. So there's more oxygen added to magnesium oxide. This causes the magnesium oxide to go from somewhat effective bowel flush to an amazing bowel flush. You just need to take it with water, 8 to 12 ounces before bed on an empty stomach. And in the morning, there should be a much better trip to the bathroom. No bloating, no cramping, no urgency, and even better, it's not habit forming like some other types of laxatives. Just take it when you need it. MAG-O7 can be found online at NB Pure and other retailers like Whole Foods, Sprouts, Amazon, Natural Groceries, or other retailers. To learn more, visit nbpure.com. That's nbpure.com to learn more about MAG-O7 and their other amazing products. Now let's get on with the show. Hello, everyone, and welcome to the GLP-1 Hub podcast. I am so lucky today to have one of my incredible colleagues again here to talk about digestive issues with GLP-1, diabetes, and all of her experience using these medications. I want to welcome Caroline Thomason. Welcome.
Thanks, Anna.
Yeah. So tell the people a little bit about yourself and your practice and your experience working with GLP-1.
Yeah, so I am a dietitian and a diabetes educator going on 8 years now. And so that's my kind of clinical background. I worked in diabetes and endocrinology for a while, and I started my private practice here in the DC area in 2020. So now I run a group practice with dietitians who serve clients for weight loss. We have many, many clients on GLP-1s or clients who are managing their blood sugar and diabetes. And then in addition to that, I also do some media work and work with nutrition brands as well.
So for the clients that come to you for your practice, are they referred? Are they self-referred? Like, how do they figure out they need a
Yeah,
dietitian?
a little bit of both. If you go to our website, carolinethomason.com, you can verify your insurance benefits
Hmm.
directly on our site. So a lot of people just find us online, they've gone to the site, they put their insurance info in, and we kind of get them started that way. But I do live in kind of a small town, so I'm actually the only dietitian in my town in Virginia. We do have a lot of local referrals too from practices here.
Okay. So are you saying that any of these insurances are requiring dietitian consults to be on a GLP-1 or not quite?
Not so much. Is that something you hear about?
I was hoping that I would hear about that. That's why I asked you.
It's interesting. There's a weight loss clinic in town and they do medical weight loss, which includes prescribing GLP-1s, and they don't have a dietitian on staff at all. It's all the MDs managing. And I have contacted them so many times. And this is like totally the norm. Like there's so many practices that don't use a dietitian. I've contacted them so many times. I'm just like, you guys need someone on your team who can talk to these people. Because what tends to happen is like, 6 months later when they're kind of like struggling for whatever reason, then they seek out a dietitian on their own. And so a lot of whether it's digestive issues I know we're going to talk about, or just other GLP-1 related things that come up, they could be mitigated for sure by chatting with the dietitian earlier.
Well, I made a post about it on TikTok the other day, and I said, if you are on a GLP-1, to say you don't need a dietitian is ignorant because, I like to trigger the people with words. And so I got a lot of pushback. Some people are like, I've been fat my whole life, and all I've ever done in my life is research nutrition, and I don't need a dietitian because I know more than them. I'm like, that's interesting because as a dietitian, I didn't know anything about these medications when I started them, and I could have known more.
Yeah, absolutely.
Like, how do you know if I didn't know? You know what I'm saying?
And these medications have been around for a while, but yeah, you can learn so much about nutrition on the internet. It's not the same as going into a medication that changes your physiology
Mhm.
and not knowing what to do with those changes.
Right, right. That's the point that I was making. Like, obviously not 100% of people need a dietitian, but like issues come up and maybe you
Totally.
do. So anyway, the pushback is just funny. So in your practice with the people on GLP-1, what are some of the things that they are struggling with when they're on the medication?
Yeah, I think when people first come in, tend to have, um, when we talk about the digestive types of side effects, they tend to have like nausea, vomiting, or maybe they've lost a lot of weight really fast, or maybe they've hit a plateau and they want to know why. I would say like those are some of the biggest reasons why people typically come in. And again, that's like a few months into their GLP-1 journey. And
Mhm.
so, their doctor has probably increased their dose quite a bit by this point, or they're trying to kind of figure out like what their basic maintenance lifestyle behaviors need to be to keep losing weight on the medication.
So let's start from like the first thing you said. So you said nausea and vomiting. So what's going on with that? And then like how do you address it? How do you figure that out with
Yes.
them?
Yes. So the way that these medications work, most people kind of know by now, but they slow down digestion in our stomach, and they also slow down sort of the processing from stomach to brain, the signaling that happens. And so what that translates to in terms of symptoms can be nausea because that food is sitting longer in our stomach. And if it sits so long in our stomach that it becomes uncomfortable, or in extreme cases, some people do vomit
Mhm.
or throw up.
Okay. And so what are some tips to prevent that from happening or the nausea becoming so bad that you throw up?
Yeah. Well, one thing I will say is most people, their doctor has titrated them up too quickly
Mm.
in the extreme circumstances of vomiting. Like, for whatever reason, they aren't tolerating the medication well and they increase too fast. That might be true for nausea, especially in the beginning. Sometimes your body's just getting used to it, or every time you increase your dose for the first day or two after your injection, you may feel some nausea. That is kind of a normal experience,
Mhm.
but it shouldn't be so extreme that it's like taking over your life and you can't eat anything. So some tips for managing. Number one, talking to your doctor and making sure that the dose is appropriate for you. With a lot of compounding pharmacies, that can be, I know that's a hot topic right now, but that can be a confusing situation to be in because you don't always know exactly how much you're getting of a certain dose. And so if your doctor's increased your dose quickly, for example, ask somebody who uses a compounding pharmacy, like, how much are you on of Ozempic? And they're like, I'm on 100. And I'm like, 100 what? Like, what are
That's
we
not
talking
it's
about?
not that's not a dose.
Right. That's not one of the doses that we would use here. So sometimes it's just vague, and there's other stuff that's in those compounded formulations
Mhm.
as well. So we have to keep that in mind. So trying to get to the source of like, how much are you taking? Did we increase too fast? Would we benefit from like scaling back, even if it was just for a week or two? Those are some of the medication side tips that I would give.
Mhm.
Nutrition wise, some nausea tips. Typically, people go too long without eating. Obviously, they're not hungry. And so instead of feeling hungry, they start to feel nauseous. And so, one of the things we can do from a nutrition perspective is try and eat small, frequent meals and make sure that we're getting a little bit of nutrition in every few hours. Even if you're not feeling super hungry, it's a really important kind of practical tip
Yeah,
that can help.
definitely. Do you recommend any like ginger chews or any of those types of things?
Yep, ginger definitely can help. Ginger chews. Vitamin B6 is a great
Hmm.
anti-nausea relief. Unisom. So these are for anyone who's pregnant, those are some nausea tips too. But if you take Unisom at night because of morning nausea, that could be one thing that helps. Yeah,
Interesting.
if you're wanting to not wake up nauseous.
All right. I actually asked my doctor for Zofran,
Yeah,
and
totally.
so sometimes it's worse than other times, so I have it if I need it,
Yep.
and that
Yep,
helps.
and trying not to drink water on an empty stomach. So if you're already feeling nauseous and you drink a ton of water, that could exacerbate your nausea.
Mhm.
So eat something first and then take small sips.
Okay. Yeah, that's good advice. And then the second thing that you said I think was plateau, weight plateau that they've haven't.
Plateaus, yeah, definitely. So people often will come in, maybe they had some really great success at first. They lost a significant amount of weight, but for the last few weeks or months, they've just found that they're kind of hanging out in the same place. And there are some reasons that would kind of explain this. One of them is that our satiety like responds really strongly at first to these medications.
Mhm.
But as time goes on, we kind of become less sensitive to the satiety benefits of the meds. So even people who are on a maintenance dose, they may be getting some of the physical benefits, but they don't feel like the satiety benefit
Mm.
quite the same anymore. So that's just managing and like kind of reconnecting with the things that help trigger weight loss and manage feeling satiated after meals is really where we go with those types of patients.
So what are some things they can do to kind of like feel most satisfied?
Yeah. So food wise, they can eat more protein
Mhm.
and high fiber foods for sure. Those are some of our higher satiating foods. We do want to make sure we can take a look like, what are they eating over the course of the day? How much total food is that? Like, have we kind of crept back up to less of a weight loss calorie range here? I think that's always important to double check. And then definitely focusing on high satiety foods, your protein, your fiber, your fruits and veggies are all going to be things that help you feel full and satisfied and kind of bring back that satiety feeling you maybe felt earlier. If you are in a plateau, I would also say taking a look at exercise, if that hasn't been something that you've started, because you maybe have just kind of gotten to a good place with food, but exercise is the next thing you can add in, even if you're just increasing steps to help trigger weight loss.
Right, right. And then do you think that people who are on a plateau, let's say, do you think that they're mostly do probably need to lose more weight, like they're not at a goal, or is it sometimes that they think they need to lose more? Sometimes people
Yeah.
take
It's
it a
funny you
little
asked
far.
that. I've definitely had people in both camps. And sometimes people have this like magic number in their head that they want to get to. And they're just like 10 pounds shy of that. And they feel like they've been there for a really long time. But yeah, if you've been on this medication for months or over a year, it's super possible that your body has gotten to a place where you're healthy, your body weight is in a comfortable
Mm.
place. It may be extreme for you to keep pushing through that plateau. So I think that's sometimes a reality check that we kind of have with ourselves and talk to a dietitian and get another perspective, like what is realistic for you.
Right, right. I see a lot of people talking about, "Well, I need to lose 5 more pounds to be at this specific weight by this specific date." And I'm just like, body doesn't really work like that. You know?
Yeah.
Like you can do all the things that you said, but it's going to kind of do what it's going to do.
Yeah. And sort of similar, I've had people who've gained 5 or 10 pounds and wanted to get on one of these medications. And while, yes, it would probably help with the weight loss, it's kind of a small amount in the grand scheme of things, you
Mhm.
know? And I think this whole conversation around like microdosing GLP-1 drugs, I think we'll have to kind of see. We don't have any research on that yet. We'll have to kind of see like where that goes in the future, if it's worth it.
Right. Now it's time for our hero bread tip of the week. Are you tired of just eating eggs for a high protein breakfast? I know that I am. So you can try this decadent high protein French toast instead. So start by whisking together some eggs, adding a splash of milk, cinnamon, and vanilla, and then dip the hero classic white bread into that mixture and cook it in a skillet until golden. Top it with Greek yogurt and berries instead of syrup. This is a quick and filling breakfast with over 25 grams of protein per serving. And if you want to give Hero Bread a try for the white bread and all of their other incredible products, they got a lot of good things coming out lately. You can get 10% off your first order with the code GLP, the number one hub. That's GLP1 hub at Hero. As a busy mom and business owner, I really need something quick and efficient to get my nutrition in for the day. I don't need another shake or powdered greens to mix up. I don't need something that requires me to take time out of my day or worry about taking it with a meal. I need something that's portable and convenient to take on my own time. Grunes does just that. Grunes are a convenient, comprehensive formula packed into 8 gummies a day. It isn't a multivitamin, a greens gummy, or a prebiotic. It's all of those things and then some at a fraction of the price, and bonus, it tastes great. If you want to give Grunes a try, you can get up to 52% off your order when you use GLP-1 Hub Pod at grunes.co. That's GLP, the number one hub pod at Grunes, GRUNS.co. So are you seeing people wanting to do that? Because where you live near DC is probably high. I live in a high rent area here in Nashville,
Yeah.
and everyone is on GLP-1 because they can afford it and they don't care, you know?
Totally. We have so many people who pay out of pocket. Yeah. Or use a compounded pharmacy nearby. Yeah. I do see that a lot. I see people who are just kind of jumping on the bandwagon.
Right.
And, you know, it is an incredible medication. Like, we've never before had truly a shot that you can take that makes weight loss easier. And
Hmm.
that is an incredible thing. So I think there are pros and cons. But yeah, some people maybe just out of vanity start with that as their motivation.
Right. Definitely. So you mentioned a few more severe things that you've seen in your practice.
Yeah.
So do you want to talk a little bit about that?
Yeah. There are some severe things in terms of side effects. I can give you a couple case studies that
Yeah.
I have encountered. I've definitely had patients who had extreme vomiting, who had to discontinue these medications just purely because of their side effects. So, there are those types of people that, for whatever reason, the medication just doesn't agree with them and they couldn't
Hmm.
ever figure out what to do. I have had another patient. So, in this, after doing some research, can happen in any situation where you lose weight extremely fast. So, she had a couple weeks in a row, this patient that she lost about 7 or 8 pounds each week. And so she lost a lot of weight in a really short period of time. She was typically losing like 3 pounds a week. So the 7 to 8 was a big jump for her. And she wasn't feeling so great. She had a lot of abdominal pain. She went to the ER one night and found that her liver enzymes were elevated. So this is something that can happen in any time where we have really quick weight loss. But it is obviously with Ozempic, with any of these medications, there's an increased risk. So for her, she was on Ozempic and went to the ER. They took her off the medication. And, there's sort of like a mental component to just like being taken off one of these meds, because it is such an emotional experience to lose so much weight and to have success in that way, especially if it's the first time for you that you've ever been able to do it successfully. So for her, there was definitely a lot of like emotional stuff that we had to kind of work through. And she was able to get back on different medication and slowly titrate it, and they didn't go up quite as high. And she did good with like eating consistently and making sure that she wasn't losing weight at that rapid rate. But, those things can happen. And these medications can have still some significant side effects if we're not staying on top of eating enough.
So if she hadn't gone to the ER and had continued on with elevated liver enzymes, could she have gone into liver failure from losing that much weight?
I think she could have had some liver damage, and she was in so much pain that I think it was like that was her last resort, was just going to the hospital
Sure.
for sure.
Sure.
But yeah, I think there could be, if they stayed elevated and if she chose not to get off of the medications, there certainly could have been liver damage there.
Right. So in terms of weight loss, because I see people saying like, oh, I only lost 5 pounds this week. What's wrong with me? What do you recommend? Because there's people starting
Yeah.
at different weights. For me, was not, I didn't have that much weight to lose. I had about 35, 40 pounds. So it wasn't, 100, 200, right? And so
Yeah.
you could lose a little more if you like start at like 350. So what do you
Right.
recommend in general?
Yeah. And this client, the case we were just talking about, she had about 200 pounds to lose.
Okay.
So she had a significant amount to lose, and she had been losing consistently for about 6 months. And one of the reasons why those couple weeks they were so high in weight loss was because of her activity level. All of a sudden, due to her work, she was walking and just super active. And so it was just like a big spike all of a sudden. For most people, I would say 2 to 3 pounds a week is probably our max. Like, we don't want to overdo it consistently more than 3 pounds a week for sure, especially when you have that large amount to lose.
Mm-hmm.
But if you have, like you're saying, if you have 30, 40 pounds to lose, 2 to 3 pounds a week might happen in the beginning, but it's going to taper off pretty quickly. And you're going to find that half a pound to a pound a week is pretty consistently what you should expect.
Yeah, that was my goal, was about half a pound to a pound a week, because I'd rather do it slow and keep it off than like lose super fast and then for some reason
Yes.
have to get off the medication and whatever.
Yeah,
So,
exactly.
but I agree with you. I think that 3 pounds is probably adequate to prevent all these side effects. So if somebody is losing too quickly, because there's some people that I see that are like super responders, like
Yeah.
they're not doing anything crazy and they're just like dropping weight. So is there anything you can do to stop that or slow it down?
Yeah. I think thinking about activity and calories are going to be your biggest thing. So making sure you're eating enough. This client, she was outside a lot. She wasn't near food. So her access to food was just kind of diminished for those couple weeks. So really staying on top of eating regularly, eating snacks, and those small frequent meals become important to prevent the rapid weight loss for sure.
Right, right. It's just really bumping up those calories as best you can. So what about somebody that like just can barely eat? I see this a lot also. Like, I'm just not hungry and I try to eat one bite and I can't.
Yeah, I hear that a lot too. I think it's sort of a mental thing as much as it is a physical thing. And sometimes we have to eat for practical reasons. And if you physically can't eat, you may be on a dose that's not quite appropriate for you, at least right now. And I know people don't always want to hear that, but if you can't eat, you have to eat. We have to maintain muscle mass. We need to hopefully be exercising on these medications. So if you can't sustain energy coming in to do those things, then we need to take a look at why that is.
What if you're on the lowest dose? Because some people like they super respond on that lowest dose. And then what do you do? Especially if you're on like the pen, because like my pen, I can't change it.
Right. I think when you're on the lowest dose or if you respond really well, I sometimes wonder if those people will sort of even out in the next couple weeks as their body gets used to it. So we're just kind of trying to do the best we can while we're really not feeling great, while we're having trouble eating, still trying to get something in every couple hours. I would do like a lot of liquid calories, like protein shakes and drinks and beverages when you can.
Right.
But yeah, managing it for a week or two. But if it persists and it's like really not getting better, then I think we got to take a look.
Right. Right. So what are any other like more severe things that you've seen?
Yeah, other severe things. So definitely the vomiting, the liver concerns. I have had people who have had like such GI bloating or gas that it's been like super painful or caused pain that they were concerned. And some of those patients have had gallbladder surgery. So they've had their gallbladder removed. And I kind of wonder if there's a connection there between like, we've already slowed down digestion. We're not processing fats very well because we don't have a gallbladder to help produce bile. So yeah, I wonder about the connection there. And some of them have gone to the doctor or gone to the ER because of the level of pain that they're
Huh.
experiencing from like gas and bloating. Yeah.
Wow, and they're not constipated?
No, the opposite often.
So what do
Yep.
you make of that? Like, what is the gas and bloating?
Yeah, it's a good question. I wish I had an answer. And I have one patient right now who's going through this, and like we really don't have an answer yet as to why that is. I will say her meal times are really inconsistent. She kind of just like doesn't have a schedule, eats, when she can, what she can. And she did have her gallbladder removed. So I wonder if there's a connection between what she's eating and she's
Yeah.
just eating too much, like she's going too long between meals and then eating too much, I think
Mhm.
is probably my first guess.
Interesting. Interesting. That's terrible. I
Yeah,
feel like that.
really uncomfortable, does not sound fun,
Not at
that's for
all.
sure.
So,
I have had
yeah.
too, like, thinking about other people with GI issues, I've had people who kind of had, like, more IBS, diarrhea type systems prior to going on these medications, and then going on the medications actually resolved their IBS because it slowed everything down. So I've had a couple people who've, like, significantly improved their GI
Hmm.
health. I had one client who was going through tons of celiac testing, trying to figure out if they were maybe, like, gluten sensitive or whatever. And then at the same time, started a GLP-1 and all of her GI symptoms improved.
Well, I think part of it too is maybe the inflammation lowering piece. So
Totally.
maybe it's like a combination of those two things that improves some of those symptoms.
Yeah. Yeah. It's hard to know too, like all of these case studies, you kind of take a little bit from each.
Right. Yeah. It's hard to know exactly what the situation is. So, what about getting off the medication? Has anyone done that successfully and maintained their weight? Like, what are your thoughts around that?
Yeah. I have definitely had people who stayed on a maintenance dose long term. And that's like officially my recommendation
Mm.
is that people should find their maintenance dose and hang out there. However, there have been people who've like either had to get off of them for a period of time or had a personal reason for wanting to get off of them. And I have had one person successfully maintain their weight, at least while I continued to see them. The others, while we took breaks, also as many as I can think of at the moment, were able to maintain. So I think short term, we're seeing like it's definitely possible to get off of medication. You do have to kind of manage any of the symptoms that pop up at the time. You might feel hungrier, you might have more cravings, thoughts about food. So you need to be prepared for anything that can, all of that food noise that starts to get louder. I think it can take people by surprise if they're not ready for it.
Right. Right. Do you find that people are like extremely hungry, like more than before when they get off?
Yeah, definitely. I think their hunger ramps up, their appetite is a lot higher, or cravings in general, just like thoughts
Mm.
about food and different types of foods that they weren't really thinking about before.
And
I
so,
do see that.
what is a maintenance dose? Does it depend on the person?
It usually depends on the person and where they capped out their highest dose.
Mm.
So their maintenance dose could be as little as half or even lower.
Okay. So it just depends on where they landed. And, my insurance doesn't cover 2.5.
So you have
Doesn't,
to go
so I have to
0.5.
be on 5. Like, that's it. That's it. They just are
How does
like,
that make any sense?
they don't cover half doses for more than one a year.
Wow.
Like, I don't know
Yeah.
why, because I'm sure the cost is the same,
Yeah.
So just here I am. Got to stay on that. So you think that it's possible then for them to get off and kind of keep it off? Or you think that there's going to be like a need for maybe a little
I
bit?
I think the average person who gets off these medications is in 5 years probably going to still feel like they're struggling. Maybe short term, they do okay. I think we've seen that. But I think we've seen in the research, like at a 5 year mark, we're not seeing that they're any better off than another diet or something extreme calorie cutting that they've done before.
Well, that's even the truth for like bariatric surgery.
Yeah,
You
it
know,
is.
the weight regain is pretty significant. And I think, sometimes when you get older, right?
Yeah,
You lose muscle, your metabolism slows and all these things. So I think it's pretty difficult to maintain your weight for very long period of time with that.
absolutely. Yeah, I think maybe people put their rose-colored glasses on and they're like, "I can be the person who, like, gets off and maintains," and it's really easy to think that
Hmm.
when everything's going really well on the medication.
Right?
But I think realistically, like, all of the problems and things you maybe struggled with before are likely going to creep back in over
Yeah.
time.
For me, I think the medication makes it so I don't have to think about food. So when I got
Yeah.
off, I just continued not really thinking. And so the portions naturally got bigger because then I could eat more. You know what I mean? So
Mm, yeah.
I didn't notice because I was just used to not really having to think. I mean, I obviously think like, okay, I need to eat protein or I need to eat vegetables or, things like that. But I just don't really like think about how much I'm eating because it does it
Yeah.
for me.
Yeah, absolutely. We all have that sort of internal regulator that tells us like when we're hungry and when we're full. And I think that's why so often we hear obesity being talked about as a disease now. We all have that barometer that some people's is just different than others.
Hmm.
And it's not a bad thing. It's just that's how certain people are wired.
Right, right. It just depends on the person. So, what is the one piece of advice that you would give to all the people out there for their nutrition to make this journey about health? Because that's what I'm trying to get across. Like,
I love it.
cool that you're skinny, but now you have malnutrition.
It's super cool that you're getting skinny, but yes, let's do it in a healthy way.
Right.
I think my biggest piece of advice would be to focus on healthy eating habits, regardless of being on a medication for weight loss. So we
Hmm.
still want to eat regular meals. We don't want to go too long without eating. We don't want to sort of let the medication take over, eating habits or lack thereof.
Right. Right. So really, like I've been trying to tell the people, focus on nutrition. You need to eat food.
Yeah.
Can't get
Eat
around that.
food. Yeah. You have to, you continue to eat even if you're on these medications. That is super important.
Yeah, definitely. So where do you see the future of GLP-1?
Well, next year, Eli Lilly is it Eli Lilly is coming out with an oral
Hmm.
GLP-1, right? So I don't think this is going anywhere. I know you feel the same way. I think we're going to see GLP-1s as a hallmark weight loss medication. I think they're going to become more accessible. They're going to become easier to administer, like with an oral dose versus an injection. And I hope that they become more affordable. I think we take 2 steps forward and 1 step back with that, but I do hope that that's in the future.
Yeah. Yeah, that would be helpful for a lot of people, but I think that a lot of insurance companies are really working hard to try to figure out how to not cover them.
Yeah, and it was, like, earlier this year that compounded pharmacies got a big ding for certain formulations, so a lot of people's access to care changed, which then increased the people who get the medications at pharmacies. Everybody went to the pharmacies, so we had, like, supply and demand issues again, so yeah, we're not quite making strides in that area, but I do hope we will get there.
Yeah, my other concern is safety. There's
Yeah.
a lot of shadiness going on. So if we can have more affordable, easier access, I think that would make a big difference.
Yeah. I will say Weight Watchers is doing a really good program. Have you heard about their GLP-1 program?
Mm-mm.
So basically, I think it's like $80 a month. Don't quote me, it's in the ballpark. So you pay your flat fee a month, but then they use your insurance and they assign you an insurance rep who like calls your pharmacies for you and makes sure everything's covered and does all of the legwork that's so hard for us to do as individuals who don't always know the right questions to ask. So they've got a good program. I'm hoping that more like that are going to be popping up.
I think Roe does the same, Roe.com.
Oh, good.
I think they have
Amazing.
like a bunch of insurance specialists, and that's all these people do is write prior authorization letters all day long.
Yeah. Yeah, it's important. I think we need people who do all of the legal jargon for us.
Yeah, it's good. All right. Well, how can people find out about your practice and you and what you're talking about?
Yeah, thanks so much. So if you want to learn more, you can go to carolinethomason.com. You can verify your benefits if you want to become a client. And if you want to follow online, I'm dietitian Caroline with an underscore at the end on Instagram.
All right, cool. Well, thank you so much for being here. This is very helpful for a lot of the people because I'm
Amazing.
sure they're
Thanks so much.
struggling. Yeah, no problem. Thank you so much for listening to this week's episode of the GLP-1 Hub podcast. I am so grateful to be able to bring you these guests every week so we can all learn from their incredible knowledge and experience. And there are so many more coming up. So be sure you are subscribed to the podcast. And if you love it, make sure to leave a review. Also, check out our GLP-1 Hub store so you can get all the resources that you need for your GLP-1 journey. And I want to say thank you to this week's sponsor, NB Pure. NB Pure is the maker of a product called Mag07, which is very popular among GLP-1 users because it helps promote relief from constipation caused by GLP-1, which can really help you not feel so bloated and full and that kind of stuff. So it can relieve a primary side effect. Mag07 is an ozonated magnesium oxide, which means it's magnesium with more oxygen added. You take the product at night and then you go to sleep and wakes up and things tend to clear up. So there's no bloating, no cramping, no urgency, and it is not habit forming. You can find Mag07 either on NB Pure's website, that's nbpure.com, or retailer like Whole Foods, Sprouts, Amazon, that kind of stuff. So all of those different shops. So be sure to check them out, and I will see you on the next episode.